Thank you, Sean, and Rico, and Bob, and Frank. Thank you very much for letting me participate in your program this year. The important part of this disclosure is the content may not reflect the position of the United States government. Obamacare, as you know, is a combination of two public laws, Patient Protection and Affordable Care Act, and the Healthcare Education, Affordability, and Reconciliation Act. It has been signed into the law of the land and upheld by the Supreme Court as a tax. It's 2,700 plus pages of content and 15,000 pages of new tax schemes to support the program. The purpose of Obamacare, overtly, and I support these: health insurance for all Americans, no discrimination for pre-existing conditions, and absolute uniformity of plans and coverage where appropriate. However, the covert part of this is control of healthcare costs and how that impacts on you. The implementation of Obamacare, really a terrible event. Non-usable web-based enrollment site cost $500 million, still spending, and the security of this website has now been thrown into great question. January 2014 to 2017, there will be full implementation of the plan except for special interest groups which have received immunity by the government if they've contributed well to national political parties. Medicaid enrollment is expanding exponentially as a result of this. It really has become, in my judgment at least, a national disgrace. Cost, latest CBO estimate is $1.45 trillion and rising. The healthcare costs shifting to Medicaid. Medicaid rolls are estimated to expand by 2019 to 80 million persons. These are state-funded programs, which will mean your property taxes, your local sales taxes, and your state income taxes will rise exponentially to fund these programs. The Medicare programs cut $575 billion, with $132 billion coming from the supplement that seniors get to participate in Senior Care Advantage programs. The result of that will be decreased availability of premiums that they can afford for people living on fixed incomes, and what will happen is these patients will be driven into the Medicaid system. Controlling healthcare costs most directly by the government establishing what they will pay for and what they will not pay for and what you are authorized to do and not do. Many hospitals will close related to decreased reimbursement issues. Regional hospitals are going to need government permission to expand operating rooms and other specialized care facilities. And that the adjudication of decisions in this regard is not possible. They're absolute. Medical service advisory boards have already been established in some areas. I've actually served on two. And they govern direction of healthcare research and cost to benefit treatment options for patients, what the government will pay for and what it will not. The ultimate aim is government control of a single-payer system for reimbursement and access. The consequences thus far: $27 billion in new taxes on pharma, $20 billion in new taxes on medical device manufacturers across the board, 1.75% increase in Medicare Part A tax, 3.4% increase on capital gains tax, and 3.4% additional tax on your income if you make over $200,000 and you're single or $250,000 and you're married. There is also, beginning in January, a tax on home sales. Sell your home, part of that will be taxed to fund Obamacare. There'll be multiple direct and indirect taxes on physicians' practices, and in a year, there will be a huge impact when the corporate-sponsored healthcare programs have to comply with the rules of Obamacare. Many of these will find that they will not meet the muster, and the patients will have their insurance canceled, putting more patients again without insurance. The solution, in my judgment, stop wasting valuable time and resources and funds to repair an unworkable law. The best option is new healthcare legislation with real participation from concerned physicians, and to do a pilot program before full implementation to make sure there are no unintended consequences. Thank you.